Good morning. My name is Brian Wheeler, Director of Communications for the City of Charlottesville. Welcome to Cville360, a program to inform and engage the Charlottesville community. During the coronavirus pandemic, the city's leadership knows you want to hear from us frequently about our actions. We also want to hear from you and provide opportunities for engagement. We've launched this program on our streaming sites, Comcast Channel 10, and on a companion Zoom webinar, so you can tune in live and on demand while practicing social distancing. The webinar allows you to join the broadcast and ask questions of our guest. If you want to join the webinar, visit charlottesville.org/Zoom for the registration information. A link to each show appears at the bottom of the page. At the top of each show, we'll have a brief update on the state of the coronavirus and the city's response from the city's fire chief, Andrew Baxter, who joins us today in studio. And after the chief's update, the remainder of the program today will focus on three issues impacted by the pandemic: our elections, the U.S. Census, and our mental health. We have guests that include our voter registrar, a member of the Electoral Board, and a team of local mental health professionals joining us. Again, on the webinar, you can type your questions in the Q&A module, or you can click the raise your hand icon, and I'll bring you onto the program to speak with our guest directly. Let's start in the studio here with Chief Baxter. And Chief, welcome back. It's good to see you in the studio.
Good to be here.
Get a little face-to-face time with you at a safe distance.
Right.
Now, I know your family has a couple nurses in the family, both working hard at UVA, and we appreciate them being first responders as well.
Sure.
So I imagine there's a lot of shop talk at your house. But what else might you be talking about with your nurses today?
Well, even in tough times, it's very important to celebrate milestones, and maybe even more importantly in tough times. So I'd just like to wish my wife, Barb, a happy birthday. She's one of our community's many healthcare warriors, and she's working today on her birthday at UVA Hospital in one of the intensive care units. And before I left the house this morning, our daughter stopped by after her night shift.
Oh, wow.
So they're real heroes, and we're proud to, participate and commit to our community in this way.
That's great. And you have a new adoption coming to your family?
We do. We have
Can we
a new
make that
puppy.
public announcement?
We have a new puppy coming. There's no name has been selected.
All right.
But by late this afternoon, there will be a new Baxter in the household. Yes, sir.
Good. Well, what can you tell us about where we are right now with the pandemic?
Sure. So our strategic goals have not changed, and we'll talk about those every time we do one of these shows, which is providing essential services to the community, supporting our vulnerable populations, protecting and supporting our first responders and our other direct service providers, and then doing what we can to flatten the curve to sustain the healthcare system. I can give an update on some of the data from the health district. As of yesterday afternoon, we have 245 confirmed cases of COVID-19. That includes, unfortunately, 12 fatalities in the health district. That's 75 in the county, 42 in the city of Charlottesville, 77 in Fluvanna County, and we've talked in previous episodes about the outbreak at the nursing home in Fluvanna and Fork Union area, 36 in Louisa, 7 in Nelson, 8 in Greene. And then in the Commonwealth, there's slightly over 1,500 COVID-19 patients in hospitals right now, and statewide there have been to date 324 fatalities.
And fatalities locally, is information being released at this point about which locality or area?
VDH just updated their website within the last several days where you can see that data at a locality level, and there are a number of other platforms. The UVA Biocomplexity Institute has an Esri-based platform that provides that down to the individual county or city jurisdiction level throughout the country, really. So,
okay. So that I know that was a big question on the last town hall that was done about COVID-19. So it sounds like that information's now.
It is, and we hope that. It's tragic every time we lose somebody in the community, and I'm hopeful that the good that comes out of that is that people continue to take this public health threat seriously.
If you've got a question for Chief Baxter, you can raise your hand on the webinar, or you can type it out in the Q&A module, and I'll be happy to ask it. Chief, I know you've got a couple public service announcements,
Sure.
Things that we just need to check off here and share with the community.
Yeah, a couple things happened at the Regional Emergency Operations Center that I wanted to highlight. We have 2 projects underway in a partnership with the University of Virginia Batten School of Leadership. One, they're helping us conduct a community-wide vulnerability assessment. That's something we do regularly, certainly in the fire service, but we really wanted to take sort of a 30,000-foot view of the community in the pandemic to really inform our next steps. And related to that, we've asked them in a separate but related effort to do research around the country and around the world from communities that have already gone through a transition from a stay-at-home environment, and what lessons can we learn from that as we begin to think about what our transition points would look like and what our decision points would look like. The other thing I wanted to highlight was the Charlottesville-Albemarle Bar Association has really stepped up, and they're going to be providing free legal services for first responders on a limited basis, but particularly targeted at some really important documents that all of us should have, particularly folks that are going in harm's way in this environment.
So give us an example of something.
Sure. So making sure that people have a will and that it's filled out correctly, powers of attorney, medical powers of attorney. Those are all things that we don't like to think about, but certainly folks in our business, healthcare providers, really ought to be thinking about, and we're very, very thankful for the Bar Association for stepping up and providing that service for our members. The other thing I did want to mention was Equip Cville. We've talked about that grassroots effort a number of times over the last month, and I just have some data I'd like to share. It's really been a stunning effort from the ground up. So in the last 30 days, through their efforts, they've generated donations of over 34,000 individual pieces of protective equipment, PPE. They've made over 250 distributions to over 65 organizations. Paige Perriello, Delegate Sally Hudson, Catherine Lawn from the UVA School of Nursing, Molly Conger have worked very, very hard on that project, and we've now been able to transition that effort and fold it in with the regional donation and volunteer coordination effort, which we announced the other day, which is taking place at St. Anne's Belfield now. So just an amazing community effort.
Mm-hmm. That's great. And then on calls to 911, what can you tell us about issues there and things that the public ought to be aware of?
Sure. So we mentioned in a previous broadcast our concern. We'd seen a drop in 911 calls overall, which is not unusual in a disaster situation or a pandemic. But we've noticed, and we've confirmed this with the emergency departments locally as well, that the question is written sort of colloquially, where are all the heart attacks? And so we want to make sure that people are not calling 911 for things that are really primary care issues, and that was our emphasis early on. But at the same time, we want to make sure that people are comfortable calling 911 when it's an emergency. So we're pushing out some PSAs.
And we'll show the community some things that go into each of those different buckets.
So on my left side, I guess, heart attack or stroke, act fast and call 911. If people are having persistent pain in their chest, jaw, upper back, down their arm, if they suddenly get anxious or very confused, if they get cyanotic or blue and have real difficulty breathing, sudden onset of nausea and vomiting, those are things that it's very, very appropriate to call 911 for. And then the other side of that, the mirror image of that is when we would encourage people to call their primary health care provider if they have a fever, a cough, they've mild shortness of breath or a sore throat. That's something that we would want them to contact their primary care provider, whoever provides their health care. And it's not going to be perfect, we know that, but we just want to make sure that people that are having an emergency call 911. We understand that there's concern about going to the hospital, and I can assure you that both hospitals in our area are taking extreme precautions to make sure that there's very, very low risk of transmission in the facility itself. So there's really separate areas for people that are COVID or not COVID related. So
that's great. Well, thank you, Chief, for that update. We really appreciate it. And Chief Baxter is going to stay with us throughout the rest of the program in case you have a question that you didn't ask at this point, and you can raise your hand by clicking that icon on the webinar, or you can type your question in the Q&A module. If you have not joined the webinar yet and you're watching via another platform, you can still do so. You can go to charlottesville.org/Zoom, and at the bottom of that page, there's registration information for each of the programs we do for Cville360. Next, I just want to give you a sense of who's going to be joining us on the program. And we're going to show all their faces to you right now, and I'm going to pull up their names. As I say your name, please wave to the group here. Melissa Morton is the Registrar for the City of Charlottesville. Jim Nix is a member of the Electoral Board. Jean Cash is Executive Director of the Counseling Alliance of Virginia. Varinia Garcia Anderson is a bilingual therapist at the Women's Initiative. And Rebecca Kendall is Director of the Community Mental Health and Wellness Coalition. So what we're going to be talking about next is the election, the census, and then we'll have the second part of the program focus on mental health. So we're going to start first with Melissa Morton, and I'm going to bring her video front and center here. Good morning, Melissa. Can you hear us okay?
Yes, sir, I can. Good
All
morning.
right, we can hear you as well. So, Melissa, why don't we start? Just let people know what's the status of the primary in Virginia and who's going to be on the Charlottesville ballot? What races?
Okay, so the primary has been moved from June the 9th to June the 23rd per the governor. And the races will be, for the Republican Party, will be a House of Delegates for the 5th District. And for the Senate, for the Democratic Party, it would be for the Senate.
So a Democratic primary for the 5th District. Is that what you said?
I said for the House, yes. And
Yep.
for the Senate, it will be yes.
Great. And what are some of the things your office is having to plan for right now?
Right now, we're planning for absentee in person, which will begin May the 5th. I'm sorry, May 8th. So many dates. May the 8th. And we're also preparing for Election Day, June the 23rd. We have to basically accommodate for more mail absentee ballots. We've got a high number of requests for those. But we're also trying to figure out a plan for in-person, how we're going to route voters in and out of the office using the 6 feet apart scenarios. We got to get protective covering equipment for our staff. We're going to get hand sanitizer stations. For voters, when they come in and out, they can sanitize their hands. We'll have a shield up so that our staff will not encounter with the voters when asking for their acceptable Virginia ID. So we're gearing up here in the office to make sure that we follow all the CDC and governor's recommendations and guidelines.
Let's bring Jim Nix into the conversation. Jim, why don't you give a quick introduction of yourself, your Charlottesville story, how long you've been here, and tell us about the Electoral Board, because I think that's something people may not understand.
Well, I've been in Charlottesville for 50 years, actually, so I've been here most of my life. The Army moved me here in 1970. I worked for then the Foreign Science and Technology Center, and then it became NGIC. I came to the board a little over 6 years ago. The board has, each jurisdiction in Virginia has 3 members of its electoral board, 2 of the party of the governor and 1 from the other party. So I came to the board in the beginning of 2014 and was just recently reappointed. And the appointments are made by the judges of the 16th Circuit using nominations from the political party chairs. So that's how I came to the job.
And I know you were anticipating lots of elections this year that you and Melissa would be involved with, but you probably weren't anticipating the pandemic, because none of us were. But what's it been like as an electoral board member watching this process unfold?
Well, we've had to learn how to meet without really meeting, and that's been a challenge. So we've been using Zoom or a Zoom-like conference, and it's a learning process, but we're getting better at it. I need to clarify something that Melissa said. It is a dual primary on the 23rd of June. And dual primaries are always a challenge because the voters have to announce which ballot it is they want. So when you apply for an absentee ballot or request an absentee ballot, you have to say whether you want the Republican ballot or the Democratic ballot. Now, on the Republican side, there will be a primary only for Senate. The nominations for the House of Representatives on the Republican side, it will be by convention, according to the current plan. On the Democratic side, there is no opponent for Mark Warner, so he's running unopposed, and therefore there won't be a primary for Senate on the Democratic side. But we do have 4 candidates for the House of Representatives, and their names will appear on the Democratic ballot. So when you apply for a ballot, you have to specify which one it is that you want. The primary for president, we were very lucky this year. We were on Super Tuesday, so we got to join with 13 other states, and that all happened immediately before the implications of the pandemic became evident and started interfering with primaries. So we got in under the wire on the 3rd of March. This primary, some of us were hoping it would be postponed, but as I understand it, when the legislature met yesterday, they made no decisions at all with regard to the June primary. Apparently there was a split decision on the May 5th local elections that don't affect us here in Charlottesville, but our county neighbors in Scottsville are in a bit of turmoil right now because they're still uncertain about whether or not there'll be a town council election there on the 5th of May.
If you're joining us on the webinar and you want to ask a question of either Jim Nix or Melissa Morton, please just click the raise your hand icon. We'll bring you into the conversation, or you can type your question into the Q&A module and I will ask it for you. Let's go back to Melissa. Melissa, it looks like you're in your office right now, but what has it been like for your team, and how many folks do you have in your office working?
Since the COVID-19 has begun, we have cut our in-office staff hours. We're currently working 10 a.m. until 3 p.m. and we only have about 2 staff members in per day during those hours so that we can work on election preparations, we can answer phone calls, we can get whatever registrations processed. So it's been a little bit busier and odd because, you don't have that group, talking and, having lunch together and all. Sometimes you may be in here by yourself, may have one other person. So, you got to keep looking out because the lights are going out and you have to make sure that people see the lights on. And it's a strange feeling. And also, just to walk into an empty building per se, it's a funny feeling.
And I do share that feeling of strangeness. At City Hall, there are not a lot of staff working in City Hall either. And when Melissa said the lights are going off, that's by design. We're trying to save money on our electrical bill, so they time out if there's no activity. So I don't want people to think that we're not paying the bill or something in City Hall. Melissa, what is the upcoming deadline that we really need to make sure people are focused on?
May the 18th is the last day to register to vote.
Okay.
So if you haven't registered to vote by May 18th, you will not be allowed to vote in the June 23rd primary. So please call our office or go online to the Virginia Department of Elections and fill out an application. And you can mail it in to us, you can fax it in to us. You can bring it to us in person during those hours, Monday through Friday, 10 a.m. to 3 p.m. Because we want each and every eligible, qualified person to get registered to vote.
And Melissa, we have a couple questions coming in. One is, if you apply and get an absentee ballot, what happens if you don't mail it in and you then just show up at your polling place? Any consequences there?
No, you can just turn that ballot over to the chief and they will process it and give, excuse me, and give you a ballot at the precinct to vote. But it has to be a city of Charlottesville ballot. We do not take ballots from any other locality within the state.
And do you have to bring that ballot? Is there any consequence if you don't bring it?
No, there's no consequences if you do not bring it.
Okay.
We prefer that you bring it, but it's not, if you don't bring the ballot, then you would have to sign an, excuse me, you would have to sign an affirmation of eligibility form just saying that you're not perjuring yourself.
Great. And then when are the absentee ballots actually mailed out?
We mail them out as we get the requests for them. And again, as Jim said, please indicate which political party you would like to have that ballot for. So as soon as we get it, we process it. As soon as we get your request, we process it and mail it out to you.
Great. And Jim Nix, any final thoughts on the election before we switch to talking about the census?
Yeah, a couple of things. As Melissa said, absentee ballots by mail should be a big thing this time. We've already received more than 800 requests for mail ballots, which is more than we had in the at this point in the general election last year. We could have 50% of our voters voting by mail this time. That means that a lot of people voting by mail will be doing so for the first time. And so it's not a really complicated process, but if you haven't done it before, read the instructions very carefully. If you have any questions, call the office. There will be somebody there every day. And the deadline for requesting a ballot by mail is not until the 16th of June. But keep in mind, that's just 7 days before the election. And you're really counting on the post office to make the round trip for you in 7 days. And that's pretty tight. The state has recognized this is a problem, and in the fall that will be extended to 11 days. So, but for this election, it's still 7 days before the election. So please be careful when you're completing your ballots. This time we have what amounts to virtually no excuse absentee voting. Although you still have to provide a reason, the governor has authorized any voter who's concerned about the pandemic and the risks of contagion to use reason number 2A, which just specifies illness or disability. You don't have to specify what the illness or disability is. So he's authorized everyone to use reason 2A, so there shouldn't be a problem.
Thank you, Jim. And Melissa, you're wearing another hat right now related to the U.S. Census, and I wonder if you could talk about the Complete Count Committee and where we are with the census and its deadlines.
Yes, I am the Charlottesville chair of the Complete Census Count Committee. Currently, it's kind of hard to get out there and talk to the households and different organizations and businesses due to COVID-19. But what I've been doing is sending out emails to different organizations and businesses to ask them if they could help with this process, to even just put a banner up on their website, just telling people to fill out the 2020 census. As you know, it's very important that we count every single household in the city of Charlottesville so that we can get the federal funding for the state of Virginia. Currently, about 44% of the households in Charlottesville has filled out their census. In 2010, the city of Charlottesville had 72% of total households fill out their application form and send it back. My goal is to get about 80 to 85%, if not, 100%, since we're under COVID and a lot of people are at home now and have internet access to fill out that form. The census has also sent out a lot of direct mailings, and you can fill out your form that way by mail and just mail it back. Starting in, I believe, the end of June or beginning of June, and it also depends on the governor's orders. Census takers will be coming to, household doors who have not filled out the census report form to see what they can do to assist. So we're trying to basically get the word out by email format so that every household can be accounted for.
And Melissa, we're going to put up on the screen here some of the reasons why that complete count is important. And I think we may be up over 56% right now locally. That may be a regional number, so I need to check on that. But my staff says we're at 56.3% on the response rate. But this involves billions of dollars in support to local communities. So it's really important to have that complete count. And Melissa, I know I took it online. I know that's not an option for everybody, but the online option is very quick and easy.
Yes, it only takes a few minutes, and I apologize for the numbers. I hadn't looked at it this morning, but I know that we're up there high. We're the highest locality with the total number of responses back in the state of Virginia. So city of Charlottesville, households, yay, we're doing great. We want to keep that number up. So you can easily go to www.2020census.gov to fill it out, and it only takes a few minutes, less than, about 10 minutes to fill it out.
Thank you. Well, I want to thank Jim Nix and Melissa Morton for joining us on the program and talking about the importance of the upcoming election and the census, and we hope everyone will take care of their census homework and get that done. The next part of our program is going to focus on mental health in the coronavirus pandemic, and I want to bring up again a view of all of our panelists so you can see them and reintroduce them briefly here. Jean Cash is Executive Director of the Counseling Alliance of Virginia. Varinia Anderson is a bilingual therapist at the Women's Initiative. And Rebecca Kendall is Director of the Community Mental Health and Wellness Coalition. So we're going to talk with this group now and invite Chief Baxter to join at any time as well and respond to questions that we may get from the community. I want to start out by asking about the disproportionality of the coronavirus and how that's impacted the Black community. And I guess my question is, how is this affecting mental health in the Black and Brown communities? And how is the mental health community responding to these inequities? Who would like to start with that? And you can just unmute your microphone and we'll put your video up.
One of the things that when we talk about the COVID and how it's impacting Black communities, one, I want to make sure I'm not speaking for all Black people. Okay, I just want to make sure I'm not doing that. However, when serving clients in the community of Charlottesville, what we're seeing, people are dealing with a lot of basically, first and foremost being the essential workers. A lot of our marginalized communities they're still having to go out into the coronavirus in the community and continue to work in order to make sure they take care of their families. One of the things that I'm trying to pull up something for us. So that's one of the things I'm seeing. I'm seeing a lot of people with isolation. The quarantine has definitely impacted them greatly. Some of my African American clients is having a hard time dealing with the financial stressors, then becoming teachers, principals, and then also cafeteria, making sure they're taking care of their kids during the day while still trying to work. Some of the efforts that I know that has been happening, which is a great thing for the community, resource hotline, all organizations supporting basic needs. There's a huge shout out to Myra Anderson and the National Coalition of 100 Black Women for their face mask drive, which is awesome. It's an example of the community's resilience, and that will help us through this crisis. One of the things since 2017, the mental health community has been mobilizing to increase access to racially aware and sensitive and also culturally responsive services. So we want to give a shout out to the Mental Health Wellness Coalition, definitely Council Alliance of Virginia Clinicians, Central Virginia Clinicians of Color Network, and the Women's Initiative and services offered. I know, Varinia, you can always jump in as well. So I think those are some of the things we're doing.
Let's bring Varinia into the conversation. What would you like to share on that question, Varinia?
Yes, thank you for having me and for having this time for us to talk about really important issues that really affect our community. And like you were saying, and like what Gene is saying, just kind of piggybacking from what he's talking about, you know, I'm not, of course, going to speak for all of the our Hispanic community or people of color, but working in the Women's Initiative, where we treat and see women from all different walks of life, you know, we do see how it does impact more of our clients of color, and the fact that they are the ones that are out there in the front line too working. They don't have the option to just take a day off or, you know, because it means that they don't have any money to pay rent or to provide food for their families. So they're putting themselves on the line of getting contacted by this virus, and that creates a lot of anxiety and, of course, stress and also isolation, because a lot of these families don't have other supports in place for them. They don't have health insurance, so a lot of times they can't access any health care for them in case they get sick or if their loved ones get sick. So it's a really hard time for a lot of our families and community. And so we're definitely seeing a lot of concerns in terms of people's mental health, and a lot of anxiety, a lot of stress, a lot of just fear of what's going to happen. And as the weeks kind of keep progressing, I think the sense of kind of like, when is this going to end, right? So it's been definitely a time for us as mental health providers to try to make sure that we're available for our community so that we can provide support.
Thank you.
But there's a lot of, like Jean also said, a lot of resources that, you know, I think at the Women's Initiative, we are so fortunate to be able to be a part of this community that works together, and, you know, just amazed in how everybody around us in the mental health community just quickly were able to started providing, you know, sessions via Zoom and telephone and getting up resources for people who really need it. So I think I'm really excited to see how the community has been really supportive and just being able to put everybody together and working together to be able to be accessible for as many people as we can be.
Thank you.
Brian,
Yeah,
Brian, can I share one more thing?
Gene, go ahead.
I think another thing that really stuck out for us as we started providing telemedicine to the community is how many people had access and how many people had Wi-Fi, or rural communities who are definitely being impacted by just the digital divide, and also just being a marginalized community. And I think one of the things that we need to do is start addressing the underlying policies and issues related to institutional and structural racism that engender implicit bias and racial disparities and social determinant in how it impacts their health. And I think with the coronavirus coming into our country, it has been able to illustrate, actually highlight areas of health inequities and disparities for people of color and African Americans. So when the COVID hit, we were African American and marginalized communities who are, who are oppressed. They've already been challenged prior to Corona around access to healthcare, access to healthy, having a grocery store in their community. So then when the coronavirus actually hits, then you can really highlight the disparity and see where the problems are coming in those communities. I think, so the policies that are created, not just in Charlottesville, but in all communities, need to be definitely looked at and how we can definitely help our people of color and African Americans access and have equal and equitable care provided for them as well.
Well, I want to bring Rebecca Kendall into the conversation. And Rebecca is somebody, Chief, who you introduced me to in 2018, right after I joined the city. We were planning for the first anniversary of August 12th.
Right.
And mental health issues were a big deal then, still are, related to that event in 2017. But Rebecca, let's bring you on. And you've been involved in a number of challenges, as I just said, but what have you been seeing and some of the top health concerns that you're hearing about?
Yeah, well, we have been hearing a lot about specific communities who are disproportionately impacted by this crisis. Jean mentioned that essential workers are very impacted. The risk that people need to take every day by going out into the world and working, whether it is doing delivery, working in a grocery store, being a service worker at a restaurant that's providing takeout, whether it is folks working in skilled nursing facilities or healthcare providers. Essential workers are definitely feeling the stress and the impact. Some of them are feeling like they need to isolate from their family. There's worries about their own health. And specifically, just again, to name that a lot of those essential workers are low-wage workers, disproportionately Black and Brown, who are bearing that burden. But we also know, this is affecting nurses and doctors. A lot of those healthcare systems, though, have more infrastructure to be able to support their employees, which is different than a grocery store or a delivery service. So we know that is a huge need. We know that older adults are particularly isolated, and that is a huge area of need. People who are older can't have the same kind of contact with family members that they have in the past, and we know that isolation contributes to stress and depression. And then we've heard a lot from parents and families who are dealing with the struggles of isolation and balancing having children home, managing maybe working from home and homeschooling, and that there's huge disparities just in the ability to manage and navigate those issues. If people are in more dense housing, that makes it harder for people to, as opposed to being able to get outside and spend some time outside in your yard. All of these things kind of impact people differently. So while we're all in this together, we're in different boats facing this storm. So I think Varinia and Jean can probably say a little bit more in terms of what they're seeing in their clinical practices directly with folks. But those are some of the communities that we know are really most impacted right now.
And Chief Baxter, I know stress first aid is something you've been preaching in our community and with city staff. What are some other things you think we need to keep in mind when it comes to our first responders and the people you're working with?
So the thing we've been talking about for well over a month now is the importance of connection. We, as Rebecca alluded to, we have an advantage in the fire service and in many ways because of the way we operate. It really is a family structure. So there's sort of built-in connection in our world. We are also very, very fortunate to have the support of the Charlottesville Professional Firefighters Association and have stood up since 2017 a peer support team. So we have a significant number of our firefighters who've been trained in peer support, and they can really sort of nip things in the bud and identify when someone might need just someone to talk to or might need a clinical resource. So that's very, very important, and we are very, very blessed to have that resource. The Stress First Aid is really helpful because it provides everybody, it's not really targeted at clinicians at all. It gives everybody a language for how to talk about and categorize and hopefully develop some healthy habits of how to deal with that stress. So it's 4 colors, green, yellow, orange, and red, and each of those colors is associated with a set of actions that we encourage people to take. And it was developed by primarily by Dr. Richard Westfall, who happens to be here at the University of Virginia School of Nursing. So, and he's helped us out a great deal since 2017. We said at the top of the show, we're always looking for good to come out of bad situations, and I think Rebecca and her work and the entire behavioral health, mental health community in this area has done just incredible work creating those networks and trying to identify sort of sub-communities and micro-communities within Charlottesville and the greater Charlottesville area and provide them with targeted, culturally appropriate treatment services and behavioral health services.
You represent our community, the city, on the Unified Command for the Emergency Operations Center.
Right.
We've talked about that in other shows. The mental health professionals joining us today are not city employees.
Right.
They may be city supported in some fashion, but how does that professional voice reach the decision makers working on the front lines as far as making sure that we're paying attention to mental health issues?
Sure. So honestly, at the beginning of a phase, an operational phase, say, a month ago or 5 weeks ago, we were beginning to think about this. It's something we always think about, but our life safety issues are really the first things, and then focusing on our vulnerable populations and really sort of trying to identify and nurture in a way that we can from a regional level, good work that's already going on in the community, and then being a clearinghouse for information and trying to connect people with the right resource. And that work takes place every day, and we're constantly refining that.
If you have a question for Chief Baxter or the mental health professionals joining us today, you can raise your hand in the webinar, or you can type a question, and I will be happy to ask it for you. I want to ask a question myself until someone else chimes in. What are the signals of need for more mental health support? Chief Baxter was talking about stress first aid and what the things are to look out for, but how do you know if people are reaching out, and how can they be connected with services? Who could address that?
So I think that it depends. I think that there's there's a lot of different services and organizations that are providing free mental health support at this time. So I think it, for example, at the Women's Initiative, we have a service that we provide every day, basically. It's called Calling Clinic, and anybody can call in, and they will get a free assessment and consultation therapy session in case that person really is in need of just wanting to talk to somebody, a clinical person who will kind of guide them through the process of what's going on. A lot of people, at this time, again, just the sense of feeling that, a lot of it's out of control. And so a lot of them feeling like, they can't handle what's happening around them. So having somebody to talk to during this time is crucial, and it's a little bit grounding for them as well. So, in our agency, we have that ability to be able to do this via phone call, and we will have a clinician taking their phone call to do a phone session with them. And so there's a lot of all the resources like Region 10 also, and I'll let Rebecca speak to that, and as well as Jean. And there's other supports for parents and kids, for example, Ready Kids. It's also an agency that works with children who are experiencing any sort of this distress at this moment. so yeah, I think there's a lot of other opportunities, but there are resources in the community that are providing the support that people need at this time.
And Rebecca or Jean, would you like to chime in?
Yeah, I would like to add in, I think, what are we seeing? Some of the things that, like when COVID just initially hit, we've seen a lot of people be in shock and awe and fear. And then in probably 2 to 3 weeks, and then probably last week, our team, our clinicians out in the community as well in the office have been seeing a lot of more hopelessness and despair, which has popped up in my sessions, especially with the older population. A lot of looking at their life, looking at their mortality, increase in suicidal ideations tend to come up, especially when you're older and you're even more isolated and you can't see your families, or you're realizing you're coming into, I am alone in this world. And COVID has really, I've seen a lot of increase so in those suicidal thoughts, and yet that's when we turn into as far as increasing the sessions that week, maybe seeing them twice a week, doing extra phone calls, supporting people, especially the multi-families when they're all together. I think they're they're doing okay, but then sometimes when people have been experiencing mental health challenges already, and now it's even more compacted due to Corona, those symptoms get exasperated, okay? So if someone had ADHD or if someone was bipolar, and now they're all around their family, and they don't have those outlets, they can't go where they want to go. So those symptoms get more challenging. And then for the family members who have to manage them, that is another symptom. That's another challenge for them. So they need support. I guess what I'm trying to say in a nutshell, that COVID really pushes the mental health issues that come out, and you'll see different signs and symptoms of like anxiety, depression, increase in mood swings. And they definitely need to, if the medication's been an issue for our travel, getting it, making sure they take their prescribed medication if they haven't been taking it regularly, but making sure that happens. And I do have a story. I know I'm working with a case where it was a mentally ill person who was transitioning out of a shelter doing right when COVID hit, and was coming from a different state. They didn't have Medicaid. They didn't have resources. And then the mental health area, the CSB was closed down or moved, transitioned remotely. And the family had a lot of stress and that happening. So that's what we're seeing in the community, those individuals who are definitely being impacted by COVID. So as far as the resources, I know Cabo, you can reach us through the website. You can reach us through Facebook. And I know Rebecca is more of she knows everything as far as like resources. So I would give that back to her. She's a guru on that piece.
All right. So. And Rebecca, one thing we can put on the screen right now is the Help Happens Here website and phone number. We're going to put that up shortly. Here it is. And the phone number is 434-227-0641. Rebecca, what would you like to say about those resources?
So the phone number it's an information and referral service. So it is not mental health services, but it's a phone number answered by city staff with the Department of Human Services that can help connect people to resources. Another great go-to is our website, helphappenshere.org/coronavirus. And we have tried to really round up the various mental health services that are available right now. So we've talked about some of the, communities most impacted. We've got the Women's Initiative that provides very culturally responsive services. Region 10 is providing a lot of children and family groups, groups for parents. The Central Virginia Clinician of Color Network is providing a weekly call-in support. So that happens on Wednesday nights. That number is 218-0440, and they've been doing great work in the community. JABA has a senior line. One of the things that I wanted to touch on is that there's a number of private providers. So if you have insurance, private providers have largely shifted to telehealth, and we can help you try to link up with private providers that are accepting new telehealth clients as well with that phone number. But a lot of the insurance companies are currently waiving co-pays for mental health services at this time. So it is actually, if you are insured, a great time to take advantage of that coverage. And if people have lost income because of losing their job, they may be eligible either for the ACA for a special enrollment period, or for Medicaid if they're very low income. So covervirginia.org is a great resource to look at possible eligibility for other insurance support, which is an important thing to be thinking about when people are in a financial transition, just to be able to make sure that you have that coverage in place. And I guess going back to your question about signs and symptoms, Brian, I just did want to say that we're going through a collective trauma right now. And so I just want to really, I think we've been trying to, as a community, normalize the fact that there is a huge mental health impact from the COVID crisis. And it doesn't mean it's a sign of mental illness in any way. We want to normalize that this is a collective trauma. And the stress first aid model really, really does that. Psychological first aid and stress first aid. It focuses on actions that people can take every day to address core human needs. So it's being safe, having a plan for when you leave the house, how you leave the house safely, how you return home safely, staying home when you can. It's about creating calm, and so knowing the kinds of things that help you to remain calm and centered. That might be taking a break from media or social media. It might be prayer or journaling. There's sleep apps that can help people with sleep. It's staying connected virtually with or by phone with loved ones and reaching out to other vulnerable loved ones to keep them connected. It's having a can-do spirit and a sense of control over the things that you can control. So building a plan for how you help support homeschooling, but in a way that's flexible and connected with your kids instead of worrying about checking every single assignment box. And then also maintaining hope is the last element. And I just really want to say that I'm amazed every single day by what people in Charlottesville are doing. There's a huge mutual aid support network that are doing amazing deeds, delivering food and prescriptions and helping to resource masks. And the community cares effort has raised a huge amount of money. The Community Foundation has been helping to support people through the community resource hotline. And so all of those things are incredible strengths in this community, I think partially because of what the community went through in 2017. And so, again, just want to normalize that and to be really thinking about those 5 core actions.
We've got a couple minutes to finish up. And Jean, any final words from you?
I think we have a very resilient community, and I believe that we will continue to support our clients and our people impacted with mental health challenges. There is one thing I do want to say. Rebecca mentioned around the copays, and when I'm running as a private provider, what I run into is that make sure you check with your insurance companies, because some people are not waiving the insurance fees, the copays. So please, because we want to support you and we want to make sure you get what you need. And it's really frustrating when you hear information like that's not accurate. So check with your insurance carrier provider as you come in for your sessions in order to support, make sure you get what you need. Just want to add that not all insurances are doing that.
And Varinia, any final thoughts?
I'm going to also just comment about how resilient our community is, and I'm just amazed at how much we are able to really come together and support each other. And I'm gonna pull up the website for the Women's Initiative in case all of you want to just check at it and look at all the information, because we also have updated information about services and resources and our different supports that we have in place for our community. And
what's that address?
It's the women'sinitiative.org.
Excellent. Well,
And they'll have all the information, and we also have updated information about the coronavirus and just what's happening in the community as well.
well, Varinia, Jean, Rebecca, thank you very much for joining us today. Really appreciate your expertise and the work that you're doing in the community. Thank you.
Thank you.
So the next show for Cville360 will be on next Thursday in 1 week at 11 a.m. And there will be 2 other broadcasts taking place from the studio. Tomorrow there'll be a town hall hosted by the Thomas Jefferson Health District. This will be another COVID conversation. They had a very successful town hall 2 weeks ago. We'll be helping support another of those tomorrow. The information is on the city's website at charlottesville.org/Zoom, and you can sign up for that webinar and participate in the town hall and ask questions of the health experts on where we are with COVID-19. Next Tuesday, instead of a Cville360 broadcast, there is a City Council work session that will be held virtually between 3 o'clock and 6 o'clock next Tuesday, and that will be focused on COVID-19, and you'll get to hear specifically where different departments are and how they're responding, how city staff are responding and keeping operations going for the city, what they're concerned about. And the public will also be able to be involved via the webinar. So you can go to charlottesville.org/Zoom to check that out as well. Thank you for watching, and please stay healthy.